Since 2011, when the NHS Midlands and East introduced the Friends and Family Test, mental health and community service practitioners were amongst some of the most enthusiastic to make contribution to the design and development of the test. Its formal introduction is a real endorsement now of the opportunity that was recognised then to build greater emotional intelligence and engagement with patients and clients in this particular pathway.
Within mental health, we rely on our service users and our carers to tell us how it is. We provide care in a range of settings, not just the hospital, but in the community and on a one-to-one basis. So having somebody tell us how it is, what was good for them, what wasn't so good, will help us improve our care that we deliver.
Friends and Family Test is a very simple question that we will ask service users or patients towards the end of their care, whether we delivered the services that they thought that they were going to get.
What we've done is we've incorporated the Friends and Family Test into a bigger questionnaire, and that whole questionnaire is administered to people who are discharged within 48 hours of their discharge.
It tells us how we are delivering care to the most important people, the service users.
Clear feedback from the service user who has been hospitalised and the family that have been involved in visiting the wards. You have to ask the person that's been on the ward and the family that go into the ward. So that's why it's important.
Some of the issues impact quite directly on patient experience. For example, cleanliness in toilets, or quality of food that is being served, or the quality of interactions that staff has with the patients, particularly when they're recovering.
You can tick a box, which is fine, but it's the narrative. Tell us really how it was for you, what we can do better, and what we did great.
There's a number of challenges that we have. The real-time feedback element is critical. It gives us the opportunity to jump onto issues straight away. Friends and Family gives us the opportunity to ask a very simple question and hopefully get a very simple, direct answer back from the patient. We really want to make sure that staff are as engaged with the patients in the Friends and Family process. That is absolutely critical for success at using Friends and Family.
We're exploring at the moment how we're going to deliver that make it work for us in the community. Given our wide range of services, we go from substance misuse to adolescent and child psychiatry. Big difference in services. How are we going to do that? Capture everybody's views, not just one little group.
In the past, clinicians and psychiatrists were separate entities and people didn't feel they could even talk to them and approach them. So this will encourage the fully inclusive society.
We are doing the same things as acutes, and therefore whether it's a mental illness or a physical illness, it's an illness, it's all part of the NHS. And I hope that that will start to make people realise that we are part of the NHS. Mental illness is no different. It is an illness of the mind as opposed to an illness of the liver or the heart or whatever. This is information, this is valuable information, and it's up to us actually coming up with the real issues, the good, the bad, the ugly, whatever it is, and then developing our services to meet those, to improve the patient and carer experience, because that's what it's all about, and that's what we're here for.